I'm Samutumwa Njekwa. I'm a gynecologist from Zambia, that is Central Africa. I learned about Merck Fertility program through the Ministry of Health for my country. Yeah, I was nominated to come for this program, and I was very excited since I always had a dream to do fertility medicine. Yeah, but at that time, it looked like this dream would never come true. Yeah. So I'm very happy to be here. It's a very wonderful opportunity for me. In my country, before the Merck Foundation Fertility program came in, we didn't have any fertility specialists. Yeah. Of course, we have a number of obstetrician gynecologists, but we are not well versed in the field of assisted reproductive techniques. Yeah. So you can imagine what our women have been going through. Yeah. We've been doing primary health care where we're able to handle simple cases. Cases were like, for instance, where we have infertility due to an ovulation or an explained infertility. We're able to do minimal stimulation, but usually the success rate was very low. Yeah. And then, you know, these challenges of fertility, they are quite rare, especially with women. In our society, it's mostly a male-dominated society. Just now that things are changing a bit. So whenever there is a case of infertility in a couple, usually the blame is on the woman. Yeah. Society looks at the woman to be at fault, but it can also be a man at fault. And this has got a lot of negative impact on the woman. Psychologically, the woman feels incomplete. Yeah. They are tortured psychologically by the husband, sometimes even the extended family. Then the husband sometimes can even bring in a second or a third wife, just trying to have a child. Sometimes there could be issues of infertility, and that is not good because it sometimes can even bring in issues of sexually transmitted infection. Yeah. And I must mention that so far, there is just one fertility clinic in my country, that's in the capital city. It's private, and it's very expensive, so it's only for the elite. Yeah. So you can imagine the common man, common women, they can't afford. It's way beyond. So once I do this program, I'm working in a government institution. It means our women will be able to access care, yeah, cheaper care through government facilities. Yeah. So I'm very happy so far with the training that I've received. Though I'm a bit worried, yeah, looking at when I go back, there will be some challenge that I'm going to face, the issues of infrastructure, issues of equipment, issues of the same fertility drugs because they're quite expensive. Yeah. So I just hope that my government will prioritize the building of infrastructure for fertility clinics and also the procurement of equipment, as well as ensure that there will be a constant supply of fertility drugs. I should mention that in the past, I think fertility issues were a bit neglected, but now the situation is different. Yeah, it's one of the priority issues now. It's a big public health concern. You can imagine that even our First Lady now is involved. Yeah, because even this link to Merck, it came through our First Lady. Yeah, so it's a serious issue, and the government is really prioritizing it. At the moment in my country, apart from the same obstetrics and gynecology that we do, we don't have a subspecialty for fertility training. Yeah. So with the coming up of Merck, this is the first time when we're going to have a super specialist in the field of fertility medicine. Yeah, I must mention that I've gained a lot of insight in the field of fertility medicine. Yeah. I've learned how to do even transvaginal scans. I'm very happy to have come to this institution. As you can see, we have a number of scans. We have simulators here. This is a simulator for ovum pickup. So they have really helped. These simulators have really helped. We are doing vaginal scans. We can do simulator. We can do ovum pickup. We're also able to do hysteroscopy, and through hysteroscopy, we're able to even to diagnose any pathologies in the uterus and also to treat them. I'm happy to be here at Indira IVF Hospital. Yeah, this institution is receiving foreign students for the first time, but they've been quite accommodative. Yeah, they've really made us settle down quite well. Then the beauty about this place is that they've got simulators Yeah. We've got simulators where we're able to train on how to do transvaginal scans, which is very important. It has given us the basics, so that even when we went in to do on real patients, it was quite straightforward. Yeah. There are also other scans, like the scan which is here. This is a scan where we've been learning how to do oocyte pickup. We have other scans where we have learned to do hysteroscopy. Through hysteroscopy, we're able to identify pathologies in the uterus and treat them. Yeah. So this place is quite unique because I've been in touch with colleagues in other institutions. They don't have such a facility. Yeah. So this place for me stands out, which is very, very, very good. So for me, this has been a lifetime opportunity to come and learn assisted reproductive techniques. Yeah. But just like I had mentioned, yeah, you've given me this skill. Yeah. Otherwise, we are so thankful, and we are hoping even other colleagues will benefit in future. I'm very thankful to Merck Foundation for giving us this opportunity. What they've given to us, the knowledge, the skills, will go a long way in helping our people. It will bring equity of access. Our poor women will be able to access assisted reproductive technique services at cheap or even free, at a free cost. Yeah. So and I hope that this program will continue. It won't just end with us, but other colleagues can also come and have this kind of experience that we've had here. Otherwise, it's been very beneficial. It will go a long way to help our people back home.